Can regular oiling actually cure hair loss?
Oiling does not cure baldness at all. Otherwise, India would not have got any bald man.
So testosterone is what causes baldness.
And every male is potentially bald. If at 45 I am not bald, then I am lucky. By the time you notice hair loss, 50% of the hair have vanished from your scalp.
1 out of 3 women will also have some kind of hair loss.
At some point of their life. Genetics loads the gun, lifestyle pulls the trigger. And as young as 25 who stopped going for colleges, studying, it is already late. Hair loss is the sign of internal disease.
Dr. Pradeep Sethi is an AIIMS trained doctor and one of India's most respected hair surgeons. His clinic has performed over 18,000 transplants.
I don't get a lot of money by doing that because that is only consultation, but I get a lot of gratification about somebody's psychology has been corrected. And actors were like, who thought that the career has doomed, and once they got the hair back, everything changed. Take biotin supplement, it will fix everything. It is not true. Self-medicate, which is definitely a blunder.
And again, you see a lot of beard serums, growth oils. There's more beard products than hair products for men nowadays.
Beard growth, I can certainly tell with scientific authority that there is no product which can grow the beard more.
Hair transplants are dangerous.
Ghost surgeries are real, not only in India, all over the world now.
These are the first 5 things that came up when I googled it. Erectile issues, low libido, ejaculation problems, depression, and testicular pain.
Those side effects that you have heard are...
What is the one hack to never go bald? So, what are the earliest signs of irreversible hair loss for men and for women?
Yes, I will start with males. What happens is, under the influence of male hormone, there is a gradual thinning of hair from thick, thin, thinner, like that. They call miniaturization. This is a planned program, genetically planned program, and every male is potentially bald. If at 45 I am bald, then I am unlucky. If at 45 I am not bald, then I am lucky. That's it, but no disease.
What should a man look for?
So when there is recession of the hairline, both this is called temple or the front, or thinning of the area on the crown to a point that scalp is visible. So if the scalp is visible, already a lot of damage has happened. So earliest signs is the signs that he can, if he thinks like there is some recession happening here, or if some people have started poking that and the crown is thinning, that is the earliest thing that he can do. But let's say somebody's father was bald, like in my case, my father was bald like grade 7, like the maximum. So I have a chance that I would also become bald.
Yes.
So if I know that, then if the doctor or the society per se, in generally educated, by 18-19, the parents should take the child to the doctor. They can take to the doctor, like, is there any chance that my son is started balding? Or is there any early signs that you can pick it up? Or what are the things that you can do to prevent? Any dermatologist who practices hair, as I said earlier, hair is the part of training and dermatology courses. So they can pick the earlier signs. And if they treat medicine, with the medications, the proven effective medications which are safe, then there is a 90% or maybe 95% chance that, the baldness will not progress, even though there is a very strong family history of baldness.
Oh, really? Mm-hmm. So if you catch it early,
yes,
it's actually preventable if caught early.
Yes.
I didn't know that. So you're saying even like a 20-year-old kid who, who has, you can see it in his father or his maternal grandfather, and he knows that it's there, and, he notices, or she, mostly he notices something. He can start taking some treatment at 20 years old also.
As early as just after 18.
He can.
Yeah.
And that will help him.
Yeah. So let's say there is earlier signs of baldness, then only he should take the medication.
Of
if
course.
there is the doctors are not very sure, then he should wait. Because it is not going to be very, very rapid. So it like maybe annual checkup, then you will see, yes, the baldness has just started, let's take the medication.
So try to catch it early, basically. Look at your parents and catch it early.
Yes. Look at the parents, catch it early. True. And maybe one brother can have the baldness started by 20. Another brother can have the baldness the same genes, everything. Then he's starting by 30. That can also happen. There's so many people in the West, and they are like a little bit more advanced in terms of this kind of, education. And they go to online, they go to third-party forums, and maybe consult doctors. So I know so many of them, hundreds of patients who all started, medications very early, maybe 20, 25,
Wow.
like that. And they're enjoying the hair for like amazingly.
That's amazing.
Yes.
That is quite amazing. What is the most damaging hair loss myth that is still practiced and believed and practiced in India today?
मैं जब से लंदन शिफ्ट हुआ तब से मेरे लंदन का पानी सूट नहीं किया और मेरे बाल सब चले गए.
हाँ.
पानी सूट नहीं किया.
I've heard that also, yes.
That is the greatest myth.
I'm washing my hair and the water is very hard.
Very hard. पानी यहाँ का नोएडा का पानी बहुत
हाँ,
hard.
नोएडा का पानी. Bombay soft. Hyderabad ये है. I've also heard that. Nothing.
Everybody, it's like every day out of these 100 patients who come to consult us, maybe around 80 they would say पानी यहाँ का hard है.
Really? That's crazy.
No, Delhi का the Delhi guy will tell Bombay का पानी hard है, Bombay वाला Delhi वाला का पानी hard है.
Bombay pani, as far as I know, Bombay pani is very soft. But why do they say that?
Oh, but like this, no, that is of course a myth, and people think like the water in which they take the shower, that is hard, that is damaging the roots.
Because they
That is
see
making
hair
the body.
fall.
Yes,
or
they
shampoo
see some of the
करके,
hair.
हाँ.
Yes. So they think like that. But miniaturization, as I told you, it is genetically, hormonally programmed at certain age, who is susceptible, and it is miniaturization from within.
Nothing to do with
from outside.
the water.
No water, no oil, no shampoo. That cannot give you programmed hair loss. That is androgenetic alopecia or hormone-induced baldness.
What are the treatments that you would recommend, you scientifically proven treatments that you would recommend?
Anybody who would like to go for treatment, or he has got an issue, or he's going to be a preventive treatment or a prophylaxis checkup, then he should go to a doctor, qualified doctor. Very, very important. I want to bring this message out through this conversation that, people who are dermatologists, they are the qualified people. Or people who are allopathic doctors who are practicing hair, they have the basic knowledge of hair. So one should go, don't start anything over the counter. Don't go to Google much. Have some basic information, but please go to a qualified doctor.
ChatGPT is not qualified doctor.
ChatGPT is again, it will pick up only those things which are available in the net.
Right.
So go to a qualified doctor and take a consultation proper. That we do for rest of the things. We do for, we have got GPs, we have got everything. Go to a doctor.
GP, not GPT.
GP, not GPT, true. So go to a qualified doctor and take a consultation, and then only you start the medication. So these medications are not over the counter. Even though you can manage, all over the world, people have managed how to get it over the counter and do something like that. Self-medicate, which is definitely a blunder.
Right.
So you will not be knowing the right doses. You will not be knowing when to taper or when to stop, when to restart. So you will not be knowing anything about that, being a non-medico. So go to a doctor and get it diagnosed well. Then be under the follow-up of the doctor. And maybe once everything is set, you might need to see your doctor once in 6 months, once in a year, maybe once in 2 years. Maybe online something will work, but never do a self-medication in this thing. And these medications are proper to be prescribed by a qualified doctor.
What are there's only there's only a few medications that actually
so
proven.
these two medications which are being FDA-approved is the Finasteride and oral minoxidil, not FDA-approved, I think, not yet, the topical one. But these two drugs, minoxidil and Finasteride, which is known to the doctors well, there are a lot of experimental things are happening that will continue to happen, but they are not, as of today, being kind of, getting prescribed. But these two drugs are known to doctors well, and we are practicing Finasteride and minoxidil. Again, so
can you tell me a little bit of how each of them work? Just a little.
No problem.
Yes.
So the Finasteride is the main drug which kind of blocks one of the enzymes which converts the testosterone into the active form of testosterone at the hair root level. So it is selectively blocks the conversion of the testosterone.
So testosterone is what causes the baldness.
Testosterone which causes the male hormone which causes the baldness.
So the same hormone
which we need for
which you need to be a man and to be strong. And nowadays people take testosterone supplements also, no?
Yeah. So that is one kind of growth hormone. This is an anabolic hormone.
So it's almost like you're too much of a man, so you become bald.
No, it is not exactly like that. So it is the testosterone we need anyway in the body to flow for all the muscles, all the organs, everything, for our focus, everything. It is one kind of growth hormone.
Right.
So which helps in anabolism, like growth. So but the testosterone, so at different organs, it gets converted by a different mediator.
Right.
That are the enzymes. So at the hair root, so that mediator is very specific.
I see.
So when you block only that mediator, you are blocking the conversion of testosterone into the active form, the dehydrotestosterone, only at the hair root level. You are not blocking it elsewhere.
Got it.
So to become bald, you don't need to have a lot of testosterone in your body. So the same amount, which is the normal amount of testosterone that is.
But it's
to
going
flow.
into this myth. It's getting not getting converted.
Not getting converted.
Got it.
So I'm just summarizing. This is a very amazing information that if somebody has got less testosterone, he will become less bald, or more testosterone, he will become more bald. It is not like that. The normal amount of testosterone which we need to function our body, that is enough to give us baldness.
Got it.
So if you are injecting more testosterone, that doesn't mean that you will become more bald.
Got it.
Like the drug Finasteride, which blocks the conversion of testosterone to dehydrotestosterone at the hair root. The dehydrotestosterone is kind of very famous as DHT. So a lot of people, they call it DHT and DHT blocker. So the drug, this Finasteride, has been researched, has been kind of done a lot of laboratory testing, and has been after that it has been published in medical journals since like more than 4 decades, and this is into practice, scientific practice. So there are a lot of products.
Finasteride is a DHT blocker.
Finasteride is a DHT blocker in a way that it blocks the conversion of testosterone to DHT.
Got it.
So it is blocker of production of DHT at the hair root.
Got it.
Not elsewhere.
Got it.
Now a lot of people who tell that they are having a DHT blocker shampoo, DHT blocker oil, DHT blocker something like that. It sounds very fancy, and people are desperate. People who want to avoid Finasteride for many reasons, because they have read so much things, and they don't want to go to a doctor. They don't want to consult properly. That is hassle. Going to a doctor, this, that, and that is hassle versus
Amazon.
Go to Google.
You can Amazon, but dekhenge to why go to a doctor?
So any product or anything, if that is not being prescribed by a qualified registered doctor, who is a registered doctor, then we cannot trust on that thing. And at the same time, if you go to the salt or the scientific name of that product and you put that into PubMed, or then you will see that yes, this has been researched, this has been published by the medical peers, and this has been accepted by medical professionals. Then only that becomes a scientific product.
Got it.
Otherwise, it is over the counter. It is just like any supplement.
So you're saying DHT blocking shampoos are not real? There's nothing like that.
So there is nothing called DHT blocking shampoos. They can't have only one thing which can block DHT, which is proven, is of course like on the hair roots, is Finasteride. Finasteride based shampoos, I don't know whether they are going to work. If there is Finasteride in the shampoo and the shampoo stays only for 5 minutes, 10 minutes maximum, that is not enough for Finasteride to work. Otherwise, any other product that people call as DHT blocker, if that is being published in PubMed, accepted by medical fraternity, then only that is a proven scientific product.
You're talking about Finasteride. I Googled it, and the first thing that came up was erectile issues, low libido. These are the first 5 things that came up when I Googled it. Exactly, it came up in this order: erectile issues, low libido, ejaculation problems, depression, and testicular pain. If I am a man of any age, if I hear all this, I will be shattered. So, what is this? Why is this there when I Google it, the first thing? Why is it the first thing that comes up?
Yes, definitely Finasteride works around testosterone and DHT. That's for sure. And there could be some cross reaction in terms of while Finasteride is working on the hair roots, it can spill over in its action to other tissues. The other tissue could be testicle, the other tissue could be something else. There could be some spillover. Depending on, again, some people are susceptible, some people are not. Again, genetically programmed. Those side effects that you have heard, that you read, are true. However, the percentage is so less that, like in my career, me and Dr. Arika practicing hair since 2008. 2008 we started practicing. 2010 we are doing only hair. So me and Dr. Arika together, we have not encountered more than 3 to 4 patients. Like 2 I have seen, she must have seen 1 or 2. So not more than 4 patients the whole our career who truly had the side effect. Most of the patients, they had a fear that you call nocebo. That means you heard about something, then you started imagining and you started getting that. Nocebo.
Like a placebo. Or nocebo.
Yeah,
Something new. Wow.
Nocebo means that you heard, you thought.
It's like a ulta placebo.
Ulta placebo.
Placebo is the medicine had an effect on me, and this had a negative effect.
Negative effect. That you, because you have read, since you have read, you are such a sharp person, you have read that. And once you
I
take
will
that,
never take it after reading that for sure.
So no, it is very psychosomatic.
Yes.
So it has gone into psych and now it will descend into the body. So, but if you have got enough education, if your doctor is confident and he knows, a lot of people who have got this side effect, there have been many studies. If you go to PubMed, you will see that while they continued on the medication, the side effect was gone. So those guys who complained about the side effect, let's say after 3 months of the medication, the doctor said, no, it is psychological, continue, let's see. After 4th, 5th month, while they are on the same drug, the side effects are gone. That means it was not a true side effect. I have done a lot of these kind of experiments with a lot of my patients. Then you can do microdosing, then you can wean them off. Then you can reinstitute with confidence.
What is microdosing?
Microdosing means, let's say it is 1 milligram per day, then you can do for 0.5 milligram per day, or you can make 0.5 milligram third day, or maybe 1 milligram only 2 days in a week. Something like that, kind of reduce the doses. You get the effect and you don't get the side effect. But true side effect, as I said, we have not seen more than 4 patients. That means it is such a nocebo thing. Unfortunately, other than this medication, there are not many medications. Minoxidil has got a different route of action that is not as effective as finasteride.
So so the second medicine is minoxidil.
Minoxidil.
Can you tell us a little bit more about minoxidil?
Yes.
And
the
how
minoxidil was like some 3 decades back. That was a medication to reduce blood pressure. So, of course, in the meantime, better drugs came, which are more tolerable, better titrated for reducing blood pressure. But this medication has, in a dose of 30-35 milligram, it has got a side effect of excess hair growth elsewhere in the body. So then the side effect was well documented. So then when the drug was discontinued as an antihypertensive, so they thought, let's use it as a topical thing for hair growth. And in different concentration that was used for topical hair growth as a topical lotion. And it had some effect. In some of the patients it was effective, some of the patients were not. But it was, of course, not a harmful medication. It was, lotions, a little bit of conversion to use. Of late, for last 5-6 years, medical fraternity doctors like me, we started using in a small milligram. Like earlier it was 30 milligram for BP, blood pressure. Now we're using 1.25 to 2.5, maximum 5 milligram every day. And we are seeing it is not
as a tablet.
As a tablet. And it is more effective than the topical, that is the lotion, and without the side effects of reducing the blood pressure. For blood pressure, we need 30-35 milligram. So this is what it does. It increases the blood supply of the scalp in a very non-specific way. It is helping, kind of stopping or at least retarding the miniaturization. And when you take that with finasteride, in tandem, they are working much better. Again, it has to be prescribed by a doctor and it should not be self-medicated.
What percentage of men and women will go through hair loss in their lifetime? Indian men and women.
Yes. Lot. It is like if you see survey, 30% males, they develop androgen alopecia in India. And that number percentage is more when you go to Caucasians, when you go to Jewish people are like, the percentage is more, goes up to 40% to 50%. But India, like overall around 30% males, they undergo androgenic alopecia.
And androgenic alopecia is
baldness.
Like so 1 out of 3 men.
That is male pattern thinning of hair, progressive thinning on the sides or the front or the crown.
So 1 out of 3 men.
1 out of 3. If
That's a lot.
if you check, like all the people are sitting here,
I don't want to
3
look
of us.
because they'll get upset if I look at them.
3 of them. And coming to ladies, ladies, like the hair loss is different than the males. Males, they have got a male pattern hair loss, that is progressive thinning of the hair under the influence of male hormone. Ladies, they don't, like a lot of them, most of them, they don't experience hormonal hair loss. Very rare. That happens in PCOS, that happens in up to menopause in some of the females. But their main complaint is excess hair fall. To a tone up like more than 100 per day.
Or thinning of hair or
Like overall volume comes down.
volume comes down.
But no pattern. Overall, from front
overall,
to back. We call
yes.
global thinning. Global thinning of the scalp hair. So that happens. Primarily, it is nutritional. Like, there's some deficiency of some of the micronutrient which is not getting kind of supplied to the hair roots or getting ingested also. Some physiological changes happen, postpartum happens, but that is very temporary. And
So mostly you're saying two things. You said 1 out of 3 women will
they can
also have
they can
some kind of hair loss.
Some kind of hair loss at some point of their life.
And it's mostly nutritional.
Mostly nutritional.
What can a woman do to address that?
Yes. So once you experience that, it is in a tune of more than 50 to 100 on a daily basis for weeks together. When you continue to have, hair coming in the comb or shampoo or pillow, then you definitely go to a doctor, go to a dermatologist and consult. Then
You can't escape the doctor.
you should not.
You should not.
You
escape.
should not. You can't.
Apple a day, doctor away, not for
At least
hair.
in this case, like, if you have got to up to 100 per day for few days, then that is normal. That is physiological. Don't go to a doctor also. But if it is persistent for more than weeks together,
How do you know if it's 100?
you can count 100, so you can count, na?
You have to count 100.
100 तो कोई भी गिन सकता है.
I don't know if I can count 100.
No, 100, like 1, 2, 3, 4, like that. You can count 100 is just a small number. So count 100, and if it is like once you know this much is 100, then next day you don't have to count.
That's
only.
a good point. Okay.
So एक बार तो गिनना पड़ेगा.
That's a big good answer there. एक बार ठीक है. हर दिन it's a problem.
Then like you know that the same amount is coming.
19-20, got it.
Sometimes what happens in my clinic is there is a female who has come for a consultation, and I know the answer. My prescription would take only 2 minutes. I know by talking to her, by seeing her, I know what is the answer. But I take a very detailed history of like 4-5 months, maybe 1 year, 2 year, and I take the history to give her the confidence that if I say no, your iron is low, or you had a crash dieting, or something like that. I identify the things very fast, but I take a detailed history to give her the confidence that you have gone through this. That takes sometimes 1 hour, 1.5 hours of consultation. And counseling a female is also, that is an art, and you have to have a lot of patience. And I don't get a lot of money by doing that because that is only consultation, but I get a lot of gratification where somebody's psychology has been corrected, and they go for the treatment and it is fixed, and they have come out of it. So sometimes I feel like, yes, I did the right thing by focusing only on hair. Not only I do hair transplant, in a lot of things happen, by hair for males, but females also. If I would not have been practicing only hair, there have been many patients where hair loss is the sign of internal disease. Sometimes ovarian tumor, sometimes some kind of carcinoma. So with 100% focus with my experience and knowledge base and my openness to consult other doctors, endocrinology, gynecologists. So there have been 3 patients who had the first sign of some ovarian tumor was hair loss. And obviously she would not go to a gynecologist or an endocrinologist for that. So we started working on the hair loss, and with the workup, we found there was a ovarian tumor about to become cancerous.
I appreciate your point that you have to go to a doctor. But, the drop-off, if someone has hair loss, a man or woman, boy or girl, and say have to go to a doctor, most people will not go to a doctor until it's very, very bad. For a little bit of thing, I don't think anyone's going to go. Is there anything they can do, like for a woman, especially if it's nutritional? Is there any supplements that you think are very safe and won't harm taking, without going to the doctor?
Yeah, like some generic multivitamins can be taken for sure. So that is
Anything
over the counter.
biotin, anything specific?
Biotin is not the only thing. Like let's say somebody has gone for a crash diet, then they can take that means all the nutrients in proportion has come down. So some of our vitamins, they get absorbed in the upper part of the like stomach has multiple areas. Some at the fundus, at body, then duodenum, jejunum. So different parts of the alimentary tract is there. So there are proportionately lot of micronutrients are not getting absorbed. So you have to take a umbrella multivitamin. Then you are getting extra supplements. That can be done over the counter. But sometimes you might not pick up the real cause.
Right.
Let's say only vitamin D3 is deficient. Then you fix that, the hair will be fixed. Vitamin D3 is one of the causes of excess hair for females.
Oh, it is, huh?
Mm-hmm.
And
Maybe
Indians have very low D3 in general.
Yes.
All Indians are deficient.
All Indians. Most of them.
So you could even do a blood test maybe.
Yes. So once you go to a doctor, they will definitely take you to the panel of blood tests, which are the common causes. Sometimes thyroid. So if you screen, then more than 60-70% chance that you will find a culprit. And once you find a culprit, then fix it. Then within 4-5 months, 6 months, you will see the result.
Got it.
It is like, as I said, more than 70-80% is fixable if you go through the proper scientific screening and workup by a doctor.
Got it. What is the ideal hair care routine? What should everyone do for their hair? Because when I look at it now, it's like skin care. There's 5,000 things. Something here, something here, something here. What hair care routine do you prescribe and what do you do?
Yes. So as a daily routine, daily habit, everyday shampoo, maybe you can do twice a day shampoo for males. For females also, everyday shampoo is necessary. Since the hair is long, they cannot dry it up easily because of they have to go to work, whatever. So they can do alternate day. But regular shampoo is the first thing. Just to cleanse the...
Every day, huh?
Every day, yes.
I always, people say once or whatever, something.
No, that is not enough to cleanse your scalp.
I see.
And don't put any hair oil. So if you're putting any hair oil, then you are kind of trying to clog the openings. The sebum has to come out and all that thing. So you are clogging that. That is a chance. So don't put any hair oil. Hair oil is, they're very ubiquitous in our, whole subcontinent. So that can be used as a massage factor. When you put hair oil, then do massage, then you will have a feel-good factor because the circulation increases. But other than that, it doesn't have any kind of scientific medicinal effect or kind of any effect which will prevent hair loss or anything.
So you have to shampoo after you put hair oil. You don't leave the hair oil.
Yes, if you have put hair oil for whatever massaging thing, then you just cleanse it up with the shampoo. So daily shampoo and no hair oil. These are the two things that one should practice as a good hygienic habit.
Wow. Got it. So my question is that, hair comes under dermatology and,
Yes.
Cosmetic. People say hair transplant is cosmetic, but hair is something much deeper than that in a way, because it's your identity. So why do you think losing hair is such a traumatic thing for people? I have some thought, but, you've seen a million scalps. So
Yes, sir. Yes. So it is so deep, so vast that even though it is only cosmetic in nature, it is not an essential organ, but it impacts psychologically so much to young kids, as young as like 15, 16, 17. Just imagine your kids are like of that age now.
they're 9 and 7. Not yet.
My kids are like 14 and 17. So they're extremely conscious about their hair, how they look.
Right.
One chap is keeping long hair because he feels he has got a big forehead and he's extremely kind of particular about that.
Right.
And the one keeps short hair because he thinks he has got less density.
Got it.
So that affects otherwise also kids of that age, and it starts when they go out and present themselves. From that age to people who are 70, 80, Boni Kapoor, he is 70. He wants to get his hair done because he wants to look younger, and that will bring a lot of kind of youthfulness to him. And when something is doable, and if they can get it done, it is scientifically doable and safe and kind of long lasting. So people have opted for that. Now coming back to the question that the impact to young people, to people who are going for colleges, going for marriages, going for professional things. People who are on stage, on camera.
Interviews.
My God, there's so many stories. There's so many. Every person is a story, and so many kind of stories that touched my heart, and that has touched the hearts of the doctors who do it. That it keeps me going. Of late, some of the doctors were like with whom I work. There's like it is no more fun, no more interesting, no more challenging to do the same thing daily. Whereas I just talk to myself. I say, what exactly in me? In me, every person is a new story.
Can you give me an example of some, like the craziest story that you heard of someone who came to you, man or woman, because it impacts everyone?
So whenever, like how I came to Mumbai, so there was a guy from Bahrain. He researched in 2012. In 2012, we were not very popular. We were in Dehradun, and internet was, and hair transplant was also not highly acceptable. It was not popularized back then.
Of course.
So he did all the research about us, but we used to post something in our website and all that. He did the research. Somehow from where, I don't know if he got to know about us. The guy used to do a lot of research about hair transplant, and he was, in particular, he saw some of our work, and he has done some procedure before. So he did all the research, and after 1 year of following us, then he contacted us. He said, I have seen your work. I want to come to you and get my hair done. He came. The aggression that I had then, I'm still continuing the same aggression, passion. And his hair was completely bald front to back, very big one, big head. So we did around 4,000 grafts. And that, of course, changed his look from the front. Then he went for the mid part and back side. It was all together, we did close to 14,000 grafts over 3 years.
So he was completely bald.
Completely,
and you pretty much
extensively
just
bald, big surface area also.
Got it.
So he wanted more density. He wanted always to be in front of the camera. He wanted to do cinema. All the things he wanted. I will not reveal his name. He's there in the industry.
I see.
And he wanted to do all those things just because he had no hair. So he was not thinking of those things. Now coming, the main important message here is, once he went to pick his daughter from the school, the daughter told him that, Papa, don't come to pick me up, because everybody says, Ganje Baap ki beti. So he told me, like, after hearing this, I started crying and I wanted to commit suicide. So that was too much, for hair and, which is a cosmetic in nature. So he told me this. So that was that touched me like anything. Then he said, Doctor, you are not meant only for Dehradun. You are not only meant for only this place. And you need to go to Mumbai. If you are in Mumbai, then of course, a lot of people whose requirement is this, you'll be able to serve them. And don't stick yourself to your own comfort zone to be staying in Dehradun. So that has kind of, that gave me the impetus that yes, I should be taking up the big bald areas like Boni Kapoor. And then for the first time in the history of hair transplantation, we picked up those kind of very big areas. Where earlier people used to say no to these kind of cases. They used to say
like
no,
fully bald cases.
Fully bald, extensively bald case. So we continue to do that. We started getting a lot of patients from all over the world. There are so many stories.
Any public persona, you would have saved their career pretty much. Definitely. If you've done 16,000 people, I was thinking, you must have done 20-30% of all the members of Parliament of India or something like that. And how and you can't talk about the cabinet because that is too specific. But I mean, 16,000 out of which most of them, because of the time and the effort and the cost, would be all, big people.
Yes. So I was just seeing once, I think some 4 or 5 months back, Forbes top 100 people in India, richest people. We have touched some 29 families.
Out of the top 100. Makes sense, yes.
And of course, most of the YPOs, EOs.
Yes.
These people are very demanding and for right reasons. And of course, if you are not one-pointed focus, if you are not good, if you are not really kind of, one of the best, then they won't come to you.
Yes.
So kind of when you serve them, then of course you are gathering yourself 100%.
I think people will be interested to know because on one side it's very personal. Hair. You look at your face in the mirror and it's balding. All that stuff is there. But on the other side, you have all these. You're saying 29 out of the top Forbes 100 families.
In India.
In India, yes. So these are people who have everything. It's like I'm already a multi-billionaire. I have everything. I have private jets. I don't need anything. I have succeeded beyond anyone's wildest measure. But still, at 60 or 55 or whatever it is, I'm like, oh, something is missing in my life. Even though nothing is missing really. Why do you think someone who has achieved so much already will want to look at something which seems so cosmetic as a hair transplant? And also, they've already been, bald or whatever for a long time. So you already know that person is bald. It's not that they're hiding anything. Nothing is being hidden. It's clear. But yet they want to go back to that thing after achieving everything. Why do you think that is?
Yeah, I think like there one lady from the top 100 families. She was 81 when she came for a consultation, and she said like her forehead was receded, age related and all that. So I have never done somebody who was more than 75 back then. It was like 7-8 years back. And I said, I told her like, नहीं करेंगे तो नहीं चलेगा, मतलब अभी जरूरत है. So this question was not the right question. I'm not asking those kind of questions to people anymore. But back then I said, नहीं करेंगे तो नहीं चलेगा क्या? ऐसे she said, doctor, how many lives you have?
Wow.
She said, I want to just live an amazing life for myself. I want to see the person in the mirror. I want to like that person. And she is now 85 or 86 and still she is going to office.
Wow.
She's working. So it is, of course, like with longer life expectancy all over the world, which India is also in the same path. And we have everything, why you should not have a good look? Why you should not have that confidence? To a lot of people, it does not matter. But now the technology, everything is so kind of, accepted now. The safety profile, everything, non-maintenance. So it is within range of a lot of people. So if something is there, so people are adapting I would say the technology, they are adapting the technology.
Emotionally speaking, who does hair loss affect more, men or women in your vast, library?
Both. Men, they never had the, option earlier to get it corrected or fixed or, look the youthful again. So now the technology, everything is, kind of accepted. It is proven. It is scientific. So safe. So for that reason, now it is there is already technology is there. If it would not have been there, they would have accepted. Okay, I'm bald. It is done. So with that denominator, so males are equally affected. Females, when they lose a lot of hair, it might not be pathological to a point, but still because this is everything for them, the beauty quotient is hair. They have a fear that once the hairs are gone, the beauty will be gone. For that reason, they are afraid. There is a huge point that, I'm sure in the conversation that will come out, that the prevention part is extremely important. The counseling part, the education part is extremely important from the doctor's side. The doctor should be always, they should be educating people that what is normal range, what is acceptable, so that the paranoia that is there in the males or females. The paranoia is more in females. The paranoia is not much in males. But they get affected equally when the male has lost hair beyond a point that it is not salvageable, then he will be affected. And younger he is, with so much social media, so much of kind of, outgoing things, informations, media. So definitely psychological, they are also hit. But lot can be taken care of. If counseling happens, education happens, then a lot of them can be taken. I would say, as I said, out of 100, 1 or 2 get a transplant. Or 99 or 98% of people, if they get right consultation, right treatment, right time, that can be taken care of.
Have you ever seen patients, you must have seen, but if you have any examples of patients delay, marriage or a job interview, they are waiting for this to happen, and then only they can move on to the next period of their life. You gave an example with your Bahrain, but any other example?
A lot of them. Like people have not picked up movies because they wanted to have the hair. People, like a lot of them, I would say, like every day, 4 or 5 patients, whatever we do amongst ourselves, everybody has got something. They have got a plan. Like somebody, next year, December, my daughter's wedding. So I will get the hair procedure done now so that the hair has grown by the time. So somebody has got, yes, my wedding, I'm planning, like, that a lot of that happens in Indian families, that my son would have hair first, then he'll look sorted, then he'll go for seeing the girls. So a lot. And
Like a part of the family.
yes,
The hair is the sixth member of the family.
Yes.
मैं और मेरे बाल.
Proper planning. Somebody said, a lot of people, they want to give themselves 50th birthday.
Got it. A new me. A new person in the
10th
mirror.
birthday, the wife gets the husband saying like, oh, now 25th anniversary, so you should be looking cool.
Millions of people still believe that shampoo can stop hair fall. DHT shampoo, this shampoo. Every day on Amazon, which I spend time on, there 1 million hair loss mask, hair loss shampoo. What is the story?
Sir, like the way we use soap to cleanse your body, skin, right? It has got the lather, the job is to the adsorbent effect that will take away the grit, dust. That is the way soap works, detergent works. Similarly, and we need to clean our body every day. So similarly, the shampoos are being meant to cleanse the hair, the dust, the grease, whatever secretions that happen from the skin. So that has to be cleansed. So that is the only purpose of the shampoo. The shampoo, it can't have any medical effect.
No medical effect.
It should not be. If it is medicated, then it has to be prescribed by a doctor. Let's say you have got dandruff or you have got some kind of itching. Then we need some particular medical thing. Then it has to be prescribed by a doctor on his prescription. But otherwise, the hair fall, the can't be stopped by a shampoo which is to be applied from outside. And the contact time is like for a few minutes. It can't be that effective that it will go inside to the dermis or below that and to kind of affect the hair follicle roots. It can't. So the shampoo, anti-hair loss shampoo or those things are true, like they're not true at all. Far away from science.
I just bought a whole bunch of anti-hair loss shampoo.
Anti-hair loss shampoo?
It's just so well advertised, ki anti-hair loss, and they give some report also 20%, and they show a photo, of hair, all that stuff. So nothing.
No way.
There's not enough time.
No way. The hair loss happens from the factors which are intrinsic, and if you fix them, the hair fall will stop, or it will reverse or whatever, male and female. It is not extrinsic at all. So anything that we apply from outside in terms of a cleansing thing, that has, it can't have any effect on the root causes of hair fall.
Now, talking about oil, as you said, it's ubiquitous in our great subcontinent. Hair oil. I have done yoga for many years, and I have heard, I'm sure you have heard, that if you do a Shirshasana, headstand, I'm laughing now while saying it because I know what you're going to say.
Shirshasana, I would say, like, what is the basis? When you do headstand, then definitely there is more blood is pulling to that area, right? So you're doing Shirshasana. So definitely because of gravity, there will be more blood will be pulling. So blood per se carries a lot of growth factors, healing materials, and by minoxidil, what we do? We increase the blood supply to the scalp, and that helps. So similarly here, by Shirshasana, so if you do for some, at least minimum time, then, technically it might help to some extent. But you are not doing it like, the blood is not pulled there forever. You change the position, you get to normal on your feet. Then whatever gravitation has happened, that has gone down. So it is not a major factor that is really
like how much Shirshasana would you have to do to really see any benefits?
Shirshasana cannot be prescribed for anti-hair loss, not at all.
Okay, got it.
So I'm saying like since there is increased temporary blood supply to the scalp because of kind of gravitation, there is some advantage, but it's not to an advantage of clinical amount that I would say like do Shirshasana every day, the hair loss will be stopped. No way.
So oil, yoga, onion juice.
No way.
None of these things. Onion juice, shampoo.
Like onion is kind of that an irritant. The onion juice an irritant. Garlic juice, onion juice are irritants. When there is some irritation happens, like from external thing, then there will be some blood supply. So when the blood supply happens, that indirectly can have some kind of effect, but that should not be that we don't prescribe. Being allopathic doctors, we don't prescribe those kind of things. Sometimes that irritants can really burn your skin. That is called irritant contact dermatitis. If it is not done under supervised things, then you can have burning, you can have really skin getting peeled up because of reaction. Because the toxins that are there, which are irritants to the skin, both in onion and garlic, that can really give you irritant contact dermatitis.
So why is it so popular? Onion juice, shampoos,
because
and oil is everywhere.
Popular because you don't have to go to a doctor. Going to a doctor is a painful thing. That is very preventive to a lot of people, which is not at all not easy way out. Not at all common sense.
Got it. Yeah, I bought some onion shampoo.
Onion shampoo?
Onion oil. Like a year or two ago, I remember. You just go to Amazon and you look at the reviews and you say, okay, if it's got 4.2 stars and like 3,000 reviews, must be a good product because, thousands of people have bought it and are giving it good reviews. But that's not the case.
Not at all.
There you go. That's a real myth then, that Amazon reviews mean something.
Yeah, at least from this conversation, that should come out. And all your audiences, they should be educated in this thing that, it is so simple that cleanse your hair on a daily basis without any fail, maybe twice a day, and no hair oil, and don't use anything which is medicated without any supervision. Let's say I got a scalp itch. Let's say there I got dandruff. Then I should consult a doctor. There are proper medications which I can use. I can be cured of that, or some maintenance thing that so that I don't have it. I don't develop that kind of thing again.
Got it.
But don't do anything which is over the counter.
Speaking of over the counter, there's products like laser helmets, derma rollers, PRP. These are just a few of the many things.
No, definitely the evidences that are there to kind of tell that they work are so low in some of the things, and if at all that has to be used. Let's say there's not enough evidence to use the laser helmets, and so we don't promote that. We don't endorse that much because we know that which is that is sometimes not very cost effective, also not very that is cumbersome at the same time, and we would go through all those things if it is really effective.
What is the craziest marketing trick that you have seen around for hair loss?
No, I won't name, but some oil people are using and the hair is growing like anything.
Yeah.
And then I saw recently some hajam, he has something and he's using, rubbing on the scalp and hair is growing. So
even mundans, people believe that
if you do mundan, then hair will become thicker. That happens in villages. I don't think that happens in cities. But yes, those people who are desperate and who...
No, it happens in cities also.
Cities also?
Yeah, many people do it for their kid for religious reasons, but also they think the hair will come back thicker. I know many people who've done it.
So like the hair would become thick or thin because of the root, which is inside the skin, 3 to 5 millimeter dip below the skin. So what we see outside is the product of that factory. The factory is inside. So if you cut it from outside or like kind of save it on the skin surface, that is not going to be kind of affected by what is happening inside.
So no kind of mundan or shaving can make your hair grow better. Got it.
Yeah, like even when I was not a dermatologist, even that was the belief. If you do more saving,
yes,
then it will become thicker.
You think that even when we are young, we realize muchhi ko karenge to aur aata hai, why are so many people under 30 graying today?
So gray is like the hair that we have, the color of black color because of melanin. That is a pigment. Pigment is a color.
Yes.
So the melanin is
in our skin also.
In skin as well. So melanin, more darker the skin, more melanin is being secreted. That is a beautiful science. So more UV rays are there in the atmosphere. Let's say the equator, Ghana, Africa, Sri Lanka,
Yes,
that
equatorial countries.
So there, the more UV rays to protect our skin and the dermoepidermal junction, which are the kind of dividing cells. God has given us melanocytes which secrete melanin. So darker the UV rays, so these cells are more dark is the skin to protect themselves.
It's a protection for the people who are closer to the equator. Which have more sun.
And more UV rays are there. When you go away from the equator, the cold countries, so where the sun rays are less, then the melanin is less because melanocytes don't have to secrete a lot of melanin. So the UV rays are less. So and if the UV rays could penetrate, then they can hit the DNA of the cells and they can generate skin cancer.
Yes.
So, but in the equator, where UV rays are not penetrated because the thick melanin, so the UV rays are required for vitamin D synthesis. So they develop rickets. They developed, have you heard of rickets?
Of course.
So
yes.
the bowing of the legs.
Rickets and scurvy.
Scurvy. So scurvy is vitamin C deficiency. Vitamin D deficiency is rickets. Rickets happens to the kids there in equator because vitamin D is not being produced because UV rays are not penetrated at all. We need a minimum amount of UV rays. So now
that's why Indians have it also.
Rickets.
Not rickets, but vitamin D deficiency.
Vitamin D, yeah, because that is also one of the causes because we have got thick melanin layer.
I see.
Darker the skin, more chance that the melanin will be more and less penetration of the UV rays. So now this melanin, which is for the brown skin and black skin, is also cause for the hair color. And for whatever reason, it is because of oxidation stress. Oxidation stress means some chemical stress that happens to the body where these melanocytes, they die. They disappear. So the hair is there because hair comes because of protein and everything. But the color, which was because of the melanocytes giving the melanin, that is not coming up. So they will grow without the color and that will turn into grey.
Is there a difference in quality between grey and black?
No, there
hair?
is no difference in the quality, the thickness, the growth rate, the
Everything
lifespan,
is the
everything is same. It is the melanocytes because of stress, oxidation stress, unknown stresses. Could be chemical stress, environmental stress, mental stress. So they get kind of damaged and they don't give the pigment and that hair becomes white. So now why it is becoming so premature? Because of maybe the overall atmosphere, the toxins, the air, the food, everything has got some chemicals which are kind of who are responsible, these chemicals, for premature aging, premature kind of then other things, the non-communicable diseases also. So we can't pinpoint why exactly this graying is happening in early years, but maybe
so is it a sign
toxins.
Is premature graying if you're a 30-year-old or 27-year-old and you're getting gray hair? Is it a sign of some health issue or is it just
nothing? I would say I would term somebody premature aging if somebody is a premature graying. If somebody is graying before 20, after 20, if somebody is graying, I would accept it as of today.
Oh, really? Huh? Mm-hmm. That's interesting. What causes chronic dandruff and what is the best way to fix it?
So chronic dandruff, some people are predisposed for dandruff. Genetically, they have got that predisposition. People who are in the northern part of India, at least, people in North India, where the temperature goes down during winters, there the sebum secretion increases and they develop dandruff. Once it starts, if you are not having the right
sebum is the oil of the
oil secretion. If you don't do right kind of hygiene, that means you don't cleanse the scalp every day, then that sebum that on the surface,
so it's like a bacterial growth.
Primarily fungal growth.
That happens because of the oil residue.
And that happens more during winters. And when not in all people.
And why in winter?
Because the sebum secretion is more in winters, because that is the temperature is a challenge or a stimulus for.
So you need a cold environment for dandruff.
You can have in non-cold also, but if you're cold, then the people who develop dandruff in cold atmosphere are more than people who are in Bombay.
I see.
So if you have got a predisposition, even the very low amount, then with the daily shampooing that will be tackled. If you're a little bit more, then I can go for some treatment with under supervision of a doctor. It should be fixed. It is not a big deal actually. Dandruff is not at all a big deal. You go to a qualified doctor, they can train you how you can tackle whenever it comes back by yourself.
But can dandruff cause hair loss?
No.
It can't cause hair loss.
It can't cause hair loss. The psoriasis can cause a little bit of hair loss. Dandruff in an extreme form, in the other spectrum called psoriasis. sebo psoriasis, like dandruff, that is seborrhea, then sebo psoriasis, then comes psoriasis. If you have got psoriasis, then that can have some temporary hair loss on the patches of psoriasis, but that is not a permanent hair loss. Once the psoriasis is fixed, the hair would come back. So that is not a permanent, irreversible hair loss.
Everybody likes beards nowadays. So, and again, you see a lot of beard serums, growth oils. There's more beard products than hair products for men nowadays. Do they work, or is it?
So for grooming beard, let's say you want to keep a shape or keep it shining, some conditioner, wax, whatever, those kinds of things, that you can use from outside. But they are not going to stimulate the beard growth for sure. Again, that is genetically programmed. How much beard I will have, to what extent, and here, this is all genetically programmed. And the thickness of the beard, everything is kind of...
So there's nothing that can stimulate?
No way. And I have learned that the big kind of beard grooming industry is there.
Yes. And beard growth industry is there also.
Beard growth, I can certainly tell with scientific authority that there is no product which can grow the beard more.
I'm in trouble.
You can groom it. Grooming products can be there.
What do you think of, what supplements would you recommend? You've talked about Finasteride and Minoxidil, but there are a lot of people like me, sometimes I'm guilty of it. I like to find natural cures, healthy cures, non-chemical, all that stuff. Supplements, for example, multivitamins, biotin. Is there any supplements that you would recommend for people that will help, the quality of hair, maybe growth, maybe just volume for men and women?
My approach would be, and that's what I wanted to, tell the whole audience of yours through this, that if you have really got on hair loss issue, or if you want to just see that, whether you are vulnerable for that, then go to a doctor and, the doctor will screen you. And if there is a culprit, let's say it is not only biotin. Biotin is very popular amongst our population, that, biotin is if you take biotin supplement, it will fix everything. It is not true. This is one of those microelements which can be at fault if you have hair loss. It could be vitamin D3, it could be riboflavin, it could be iron, it could be zinc also.
So is there what would be great is if you can, for everyone who's watching, because like you said, you have to do a blood test. But would it be possible to tell us a bunch of...
So now the multivitamins, all those multivitamins, they have got everything, some amount of everything. So if you take the supplement, that would improve your general well-being also. And that will take care of your, hair as well. So any multivitamin which is kind of, prescribed by a doctor, that is okay. There is no multivitamin that you should take to prevent your hair fall. Once you have got something, then you take a multivitamin. Then that approach is a little bit rational. I don't kind of endorse the concept that take a multivitamin, you will not have a hair loss.
Got it. Always good to know. Because you try to think of, supplements as a preventative thing. You have a multivitamin sometimes just to be healthy.
Yes, somebody who is healthy, that means he's taking balanced nutrition.
Got it.
His diet is, everything, it contains everything, because he don't have any, if he has got an issue in hair, then he can have issues somewhere else also. The whole body is kind of, taking the nutrients, and, every organ is interrelated. So it can't have a isolated hair issue and with a nutritional thing, and you don't have elsewhere issues. Let's say somebody has got an iron issue. The hemoglobin is low. It is 8 gram or maybe 9 gram, and persistent. That means the iron is low, the oxygen kind of, things are, the carriage is at fault. So then you will have weakness, then you will have lethargy, then you will have so many things. You will be easy early tiredness. So those are the other symptoms. And of course, in addition, you will have a hair loss. So the cause for everything is low iron.
So you have to dig a little deeper.
You should always. For that reason, skin and hair, they are the external sign and symptom of internal diseases. So what we study in dermatology, when I see some issue, some skin issue, then I should be able to trace back what could happen, what are the internal organs that are affected. Could it be liver? Could it be blood? Could it be
bone
marrow?
Can you tell sometimes, if you see me, and you see my face or my hand, skin, can you tell if I have liver problem or...
Yes, there are so many, what the whole dermatology course, 3 years of padhai is on that only. Na? When you when there is a skin issue, some patient has come, it is not only dandruff, it is not only hair fall, it is not only pimple. There are so many other things, like rarest of things. Internal, cancer is there. Let's say somebody has had a cancer in blood or something like that, and some elements in the skin. By seeing that, we are able to, make the diagnosis.
Right.
Or we can trace. We can, of course, we go for confirmation.
Right.
So there are like whole 3 years ki itni badi lambi padhai is on that only. It should be a master of internal organs.
Got it.
And it should be master of skin. And skin is the largest organ of the body.
Awesome.
Anything that happens inside, it has got some effect on the skin and the hair, nails. By seeing only nail, let's say the longitudinal blackness is there. That means you have got, that is one of the signs of iron deficiency.
Got it.
There's so many. So 3 साल की पूरी पढ़ाई है.
What is a hair transplant? Just the basics, can you take us through? Because the word transplant, mostly when you ask a layman, they think of kidney transplant, heart transplant. I think those are the 2 main ones.
Liver transplant.
Liver transplant, rare.
Bone marrow
but
transplant.
Bone marrow transplant means transplant means very scary, hospital, near death. That word has that thing.
The transplant means very severe, life-saving.
Serious, life-threatening, life-saving. And a hair transplant is also life-saving, as we saw.
Yeah, the concept is same. The organ is taken from one area to another area. Transfer of the organ. It is not multiplication. It is not reproduction of the organ. So it is taken from one place where it is more to another place where it is less. So there is a proper physical transfer. So let's say you have got 5,000 in one area and 0 in another area, and you have taken 2,000 from here and put there. So now we are left with 3,000 here and 2,000 have come here. So total is 5,000. So
but one more thing is, sorry of interrupting, in all the other transplants, they are from a donor, another person,
another body,
another human being, dead or alive, to you. But here,
so in hair transplant, of course, your own body is used as a donor. So where the hair is resistant to the male hormone, you have got, good quality. And
for example, where?
For usually the backside of the scalp, this is called occipital area. This area just above the ear or in front. This is the horseshoe area. From here, this is the area the which is apparently more resistant to the male hormone. And we take hair from here. And of course, you have to respect the anatomy, respect physiology, respect a lot of things. So you cannot, you have to be very, very diligent enough. In hair transplant, the hairs has been taken from apparently the resistant area, that is the backside of the scalp. And yes, this is the horseshoe area.
Where people don't go bald that much, basically.
Yeah. And from there, hair, they have been extracted and placed on the area where they are bald. So that simple. But of course, there are a lot of sciences involved. Like, you have to respect the anatomy, the depth, and each hair has got different quality. Each area has got different quality. You have to understand the quality of the hair of that area. Then you have to put that hair in such a way that it looks normal, it looks natural. And that is the real artistry. So the science, of course, you have to master that, which hair to pluck, which hair not to pluck, which is going to grow, which is going to last for a long period of time. That you should master. Like the end goals of any hair transplant is like the patient wants that the hair should look natural. It should be long lasting. The donor area has to look as if it is not being used. Then it should be able to cover the large area, whatever area it is, and the scalp should be visible. So these are the end goals. So one should definitely master all those things. The team who does hair transplant. But to me,
and just one question I had, was that what do you think? For many people, the word hair transplant is scary because they're connecting it to transplant. What would you like to say about that?
Yeah, okay. So here in this transplant, your own body is being used as a donor. So it is not that it will be rejected because your own organ. So in hair transplant is not a thing which is going to be kind of something which is going to create an emergency. Because let's say I've taken a kidney from somebody and my body, that is a foreign substance for me, my body will try to throw it out. So to reject that throw, so I kind of reduce my immunity. So we go for some immunity lowering medications. So when your overall lowering your immunity because of the kidney transplant, you want to prevent the rejection, then you are prone for infection, prone for other things. So for that reason, it is scary a little bit. Of course,
And it's a big surgery also.
big surgery, and that is life saving. So
Yes.
that way, hair, since it is your own body's small organ and it being kind of transferred, so the chances of rejection is close to zero because your own body. Then, but you have to respect all those principles of transplant. That is, it has to be immediately placed, right place, right angle. So that there is no compromise on that. The diligence that is required to save an organ is the same.
How do you decide who's an ideal candidate for this?
So as I just told that, usually the end goals of any hair transplant, just to tell you again, they want a natural looking hairline, they want proper coverage, density, and it should be long lasting. And if the patient has got unrealistic expectation, then definitely you should not be doing that, because you have not brought him to the point that hair transplants are not perfect. So there are many things like, let's say somebody, the baldness has just started thinning, the hair has started thinning. It is not thinned enough that the enough area is there or in emptiness to do a transplant. Even the patient is pressing, don't do it. So let's say his scalp is not normal, his blood pressure is not normal, his blood sugar is not normal. So they are not eligible, or his expectations are unrealistic. So they are not eligible. And let's say somebody doesn't have donor, for whatever reason it is very, very less, and he has a big area and his expectations is very dense. So that has to be a lot of counseling happening and discussion happening to know that whether he's really kind of has got the grafts or his expectation, everything should be set, and you should be on the same page.
Got it. And because you said only 2 or 3 out of 100 do it. So what are most of the people who get rejected?
So most of them, because they are just in the early part of the thinning, and we at Dr. Arika, and we at Eugenics, what we do is, if it is preventable, if it is in the stage that we can give him medications and probably it can salvage some of the hair back, some of the hair can become thick, we go for religious trial of medications. For 6 months to 1 year, we see that we keep the patient under follow for 6 months to 1 year, just to see if he has not tried medication ever and still a lot of scope of baldness is there, we start them on medications.
Got it. To your point, what should someone look for if they're choosing a clinic for a hair transplant? What are the red flags? I don't want to go here because of this.
Yes, true. So they should use their common sense. They should meet qualified doctors. If not possible in person, they should do online. They should talk to them on phone or video conferencing. I always advocate that do a research of not less than 1 year, because this is not emergency. Take your time. So when you do those kind of research, then the chances that you will do a mistake is very, very low. But if you are very impulsive, you are jumping to the next door place, which is geographically nearby, very, very cheap for you, then already you have cut the corners of your due diligence, and you'll be ended up in trouble, not only risking your health, but also kind of risking your grafts. And I was telling you in the early part, one guy who has got a procedure from somewhere else, his hair was looking very plastic, very drawn. He was unhappy. He got it done from somewhere else. And the other guy who was our patient, both our friends, they went to, he came to us and the other guy to another clinic. So he's damaged mentally, very catastrophic. Whenever he sees himself in the mirror, put the hair like this, he sees a line. He feels so bad about himself. So that is also a very bad side effect. So you are risking, your psychology, everything. Unfortunately, we at Eugenics, me, Dr. Arika, the whole team, Priyadarshini and all, we are almost daily we are fixing 2 or 3 patients who got a bad hair job somewhere else. Got it done in Turkey or some cheap place. So once they have got a bad procedure, then they start doing the real research, where to get it fixed. So it is very difficult to give a natural look again when it is a bad job. So we say do it once, do it right. Do a research for at least kind of 1 year.
Like an arranged marriage. 1 year of research.
1 year of cooling period or what? Knowing each other. Yes.
What cutting edge hair restoration technology excites you today and for the future?
The technology that next which is going to come up is definitely stimulating the stem cells. The hair roots on the backside has got stem cells which are resistant to the male hormone. if those stem cells can be kind of extracted, populated, that is multiplied under right environment, so that they are under check, they are not cancerous, they don't acquire mutations, and if they are injected back into the balding area, once it is completely bald, they are not going to help. But let's early part of thinning or balding, they could reverse the thinning. They could make the hair thick again forever. So my mind is on that subject for last 6-7 years, and maybe by end of this year, maybe early part of next year, I'm going to invest a lot of my energy into that. People are working in different parts of the world, but I believe I had a lot of exposure while I was in AIIMS. So there was the stem cell department, the organ transplant department, and my roommate was working in the stem cell department there. So and I'm working on hair. So my mind is into that. Now I'm more like a clinician. I want to shift from a clinician to a more like a researching doctor.
Got it. And because you keep hearing about biotechnology making so many advances now. Anything else that you think is going to happen, like some tablet you take which is going to stop all hair loss?
No. So there like some medications like alternative to finasteride, which will be more topical in nature, more potent in nature. They might come. Again, they are on experimental stage. I don't want to name them, otherwise people will start Googling and start, kind of
For
over the
sure.
counter procuring. They'll try to do the black marketing also. Some of the drugs are there, but we don't have as of today anything concrete on that.
So I just want to ask you a few questions about hair. You have seen you have done 16,000 hair transplants.
Your whole group.
Means everyone under you has done 16,000. So how many scalps have you seen?
So the number is like if 100 patients are coming to us to get a hair transplant or consult for their hair, only 1 or 2 they are eligible for a transplant according to our kind of screening system or our eligibility criteria.
So that would mean like almost 100,000.
Yes, like 16,000 into 100.
Into 100. 160. No, that's 1.6 million.
Yeah, that should be the number.
1 million plus scalps you've seen.
Yes.
So
screened 1 million scalps.
Yes.
Screened
so
by
seen, felt, and everything. So I mean, therefore, you know more about scalps than mostly anyone, I would say.
Yes. So we have got like 12 doctors, and every day we get query of around close to 300 odd patients. And out of that, some people are real, like we have got screening systems. So at least 100 patients are being kind of seen through digitally or in person by our doctors every day.